Every year, up to 2,000 people in the U.S. and Canada die from anaphylaxis, a serious allergic reaction. The most common causes are allergies to peanuts, insect bites, and seafood. But not all anaphylactic reactions are severe. They can be mild, with subtler symptoms. And most people don't know that if you've had a mild reaction in the past, you're at risk of having a life-threatening one in the future. More from Mayo Clinic on a new anaphylaxis awareness campaign. John Lindean's reaction came on fast.
I started to feel a little dizzy. It was becoming very, very difficult for me to breathe.
John remembers reaching for the phone to call for help. When help arrived, he was in big trouble.
I was collapsed and unconscious on my kitchen floor, having turned a shade of blue.
John's episode was likely triggered by peanuts. He's been allergic since childhood, but symptoms had always been mild: nausea, hives, and flushing.
Those who've had a mild allergic reaction to a food substance or an insect sting at one point can have an anaphylactic reaction unpredictably in the future.
Dr. Wyatt Decker says anaphylaxis happens when your immune system identifies a substance, such as peanuts, as foreign. This triggers cells called mast cells to release chemicals that cause many symptoms, including dilated blood vessels, low blood pressure, flushing, constricted airways, intestinal problems, and even death. But an injection of epinephrine from an auto-injector can reverse symptoms and save your life.
Pull off the cap and you hold it to your thigh and you inject it, and then you hold it in there for 10 seconds.
Dr. Ronna Campbell and Dr. Decker have teamed up with other health organizations to teach people about anaphylaxis. It's called the Be Safe campaign. S means seek support, call 911. A stands for allergen, try to identify what caused your reaction. F is for follow-up, see your doctor afterwards. And E is for epinephrine, the medication John carries with him in case a severe reaction happens again. Dr. Decker says if you have an anaphylactic reaction, it is vitally important to seek emergency medical care. That's because sometimes symptoms can get worse or even recur within 24 to 48 hours. It's also important to talk to your doctor after an allergic reaction to see if you should be carrying an epinephrine auto-injector. The team of experts spearheading this campaign includes members of the American College of Emergency Physicians and the American College of Allergy, Asthma, and Immunology. The Food and Allergy and Anaphylactic Network is a great source for interested patients or family members. For Medical Edge, I'm Vivian Williams.
Now I'm going to cover some of the other treatments that we might give in the case of an allergic anaphylaxis reaction. Now what we have here, with any patient we're going to start an IV. Now when starting an IV, this gives us access to a lot more medications that we can provide for the patient. A big thing that we want to do is we want to make sure that the patient's getting plenty of fluids. And so the IV helps us to give them medications, and it also helps us to give them fluids, which helps to keep their blood pressure up. Now over here is a few medications that we can give. Right here is the basic EpiPen. Now several people that know they have severe allergic reactions may carry these. And when prescribed by a doctor, this can be used by someone that's not trained. Now we also carry some of these on us just for convenience. The next phase is we carry this epinephrine here, which is the same thing that's in the EpiPens, but this version of it is designed to be given as a shot. So we can give this as a shot in the arm or in the leg. Now this here is another form of the epinephrine, and this is so that we can give it to the IV. And so I guess this would be a progression. We'd start here with a shot in the arm, and then if it progressively gets worse, we can move on to an IV there. A couple other things we carry is we carry the albuterol and another medication called Atrovent. Now these are given through, this is called an SVN, and what it is, it nebulizes these drugs here. So when placed in there, it's going to cause it kind of vaporizes it and puts it into a small mist, and causes it to go through. We connect this to oxygen, and then it goes through, and they're able to inhale this medication that gets into their lungs, and it kind of helps their upper airways to expand so that they're not constricting from the reaction. And then this here is just a small thing of Benadryl. Now this is the Benadryl. It's the Benadryl that's designed to give through the IV. So it's a little bit more potent than the Benadryl you're going to find at the pharmacy or that you may have at your house. There's a few other medications that we carry, but this is just giving you a basic overview, and each organization may differ in the treatments that they give. But these are some of the basic treatments that we'll start off with, and then even with us, our biggest treatment is we're going to want to get them to the hospital as quickly as possible. We'll do our assessment. We may start giving some treatments, but again, our treatment's also going to be get them to the hospital as soon as possible.